Hi everyone. Today we are going to see what is HIPAA and how all the medical professionals or even healthcare business analysts needs to know what is HIPAA. Let's get started. So HIPAA means Health Insurance Portability and Accountability Act. It is a privacy rule, okay, to make sure the patients, right, their information are protected. Okay, it could be patients' names or their address, zip code, their dates related to health, their phone numbers, email addresses, social security number, medical records number, or any health insurance information. Okay, so their vehicle identifiers, it could be anything, even their diagnosis, and also their photo, right? So it could be anything. Okay, those are called PHI, patient health information. So these information should not be shared with others. Okay, since medical professionals will have access to the patient information, we are not supposed to share this information to others. Okay, to protect that, this law was created. So many people in the medical industry, so doctors, nurses, healthcare business analysts, will have access to patients' information, their diagnosis, their address, their social security number, their reports, their claims information, and so you will have access to all the information in the database. So we need to make sure we are not sharing that information with anybody, not even to your family members. So you're not supposed to share with anybody. Okay, that's the law. If you share those information with anybody, then you have to pay fines, and legally you can be sued. So there are a lot of complications. Okay, so if you are hired as a healthcare business analyst, and if you're working for a healthcare company, and if your client is healthcare, so they will ask you to sign a document for HIPAA while you get a job, to make sure that you are not sharing any information, okay, any member's information or patient information. So that is HIPAA. So it will include all the medical records. For example, if you are healthcare business analyst, right, all the claims information will be available, like when did they go to the hospital, what disease they had, how much they paid, how much insurance paid for that particular claim, and why it got rejected. So all the information will be there, right? So we are not supposed to share any of this information. You're not supposed to share to anybody. That's the whole point. Also, you're not supposed to print any records. So if you are working from home, and if you have an office laptop, you're not supposed to print, right? In your home, you may have printer. So any patient information, right, from your office laptop, you're not supposed to print. That is against HIPAA. So make sure you don't take photographs, or you don't write notes about those patients' records, or you don't print those documents. So if you do print all the members' information, then it means that you are against HIPAA, and you can be legally sued, or they can fire you from the job, or you need to pay penalties. So whenever you join in the medical field, right, make sure you don't print any documents, and you make sure that you don't take any screenshots, or you don't record anything, or you don't write member data in your personal computers, and nobody in your family has access to those information. So in the interview, if they ask what is HIPAA, do you know about HIPAA, you need to say that HIPAA is a privacy rule. It's a law in the US. That's a standard in the industry to make sure that we are properly using the patient's data, and how we should not disclose PHI. PHI is patient health information or protected health information, and who can have access to that information. Okay, even if the doctor has access to that information, you need to make sure the doctor doesn't print those records. Okay, so that's the whole point of this rule. So we are protecting all the patient information. Hope this video is very helpful. Thank you for watching.